Congress and gave the White House over to President Bush, this country was running a significant surplus. So what happened over the last 10 years to take us from a surplus situation into a record-breaking deficit situation? Well, a couple of things happened. We fought 2 wars, war in Iraq, war in Afghanistan, unpaid for. We gave huge tax breaks to the wealthiest people in this country, unpaid for. We went through a Wall Street bailout, much of which has been repaid, some of it has not been, unpaid for. Congress passed the Medicare Part D prescription drug program written by insurance companies, unpaid for. You add all of that up, you end up with a very large national debt. The other reality that we have to understand, if we're talking about moving toward deficit reduction in a way that is fair, a lot of ways you could do it, but in a way that is fair, you have to understand what's going on economically in America. And what's going on in America today is that the middle class is essentially disappearing. Median family income has gone down by over $2,500 in the last 10 years. You got millions of workers, including many in Vermont, who today are working for lower wages than used to be the case. Poverty is increasing, but the people on top are doing phenomenally well. Over a recent 25-year period, we have seen almost 80% of all new income go to the top 1%. Top 1% now earns 22% of all income in America, more than the bottom 50%. You have the 400 wealthiest people in this country owning more wealth than the bottom 150 million Americans. So, when you talk about deficit reduction, it seems to me you have to put it within the context of what is fair. What is fair? And what is not fair is that in the middle of a recession, you take away programs desperately needed by working families, by the middle class, by children, by the sick, by the poor. And at the same time, while the wealthiest people are doing phenomenally well, say, okay, we're going to give huge tax breaks to the very, very richest people in this country. And that is exactly what the budget passed by the Republicans, the so-called Ryan budget, does. It makes devastating cuts in Medicaid, which will be especially harmful to a lot of families and seniors who are in nursing homes. Don't know what's going to happen to them. It ends Medicare as we know it and transforms it into a voucher program in 10 years by which seniors, people 65, will be given a check for $8,000 to go out and buy a plan through a private insurance company. Good luck to you. See how far that $8,000 plan goes. And all of the studies estimate that there will be a significant increase, a doubling of out-of-pocket expenses for seniors as a result of ending Medicare as we know it. The Republican budget plan makes devastating cuts in education, in Pell Grants, in nutrition programs, in senior programs. Meanwhile, it doesn't ask the wealthiest people in this country to pay 1 cent more for deficit reduction. No shared sacrifice. All of the pain is placed on the backs of the middle class, working families, lower income people. And that seems to me just absolutely unacceptable. So the issue here is, what does the president do? What do we do in the Senate? I'm a member of the Budget Committee, and I've been fighting very, very hard with some success on that committee to say that the budget that we produce has got to call for shared sacrifice. When the wealthiest people are becoming wealthy, you know what? They're going to have to contribute something to deficit reduction. When corporate profits and oil company profits are very, very high, and these companies enjoy all kinds of loopholes, we're going to have to end those loopholes. When we're losing $100 billion every single year by companies and wealthy individuals putting their money, stashing their money in tax havens in the Cayman Islands and in Bermuda, you know what? We're going to have to end those loopholes. But you cannot simply balance the budget on the backs of working families and the most vulnerable people in our society. So that's an issue we are going to be playing a very, very active role on, and we have been for the last several months. Okay, those are two of the issues out there. Any questions?
Yeah, how do you plan to get bipartisan support for to corral in speculation?
Well, I got to tell you, I mean, you know, the issue of high gas and oil prices is not just an issue that impacts the state of Vermont. It impacts every state in this country. There are rural states which have Republican senators and Republican House members, and I am absolutely certain that constituents in those states are writing to their senators and their congresspersons, whether they're in Arizona or whether they are in Mississippi or Alabama. They are experiencing the same problems. Wages are going down, gas prices are going up, they want action. And I think we're going to give our Republican friends, I think some of them who may not be unsympathetic to what we're trying to do. This is not a new idea. We've been fighting this issue for a number of years. I think where we have made some real success is that a couple of years ago, when we talked about speculation having a huge impact on oil prices, a lot of people said, well, that's not really the case. I think most people understand it differently now. So I think we stand a reasonable chance to get
There's not an ideological divide, do you think?
Well, there's always an ideological divide, but I don't know that this is a free market issue. When you have financial institutions controlling 70–80% of the oil futures market, I'm not sure that that is free enterprise. I think what most people believe is, if, for example, airlines need more oil, truckers need more oil, we may have a cold winter and we need more home heating oil, we can understand the prices may go up. But when you have more supply today and less demand, tell me how that's free market. That is the very opposite of free market. That is, and that's what this Wall Street Journal article today shows us. Big banks cash in on commodities. Tell me what that has to do with supply and demand. Not much.
So the CFTC, that's also the same organization that was in sort of quote unquote in charge of oversight around Enron too, and commodity
That's
speculation
right.
at that time. So,
That's right.
but so talk a little bit. What was that reform supposed to do in the Wall Street, or the Wall Street Reform Act last year? Wasn't it supposed to tamp down on some of this?
Absolutely. What it was required, it didn't say, hey, please come up with a study. It said to the Commodity Futures Trading Commission that by mid-January, you must end excessive speculation in the oil futures market. You must do it. They haven't done it, period. And
what was his reasoning for saying?
Well, wasn't all that quite clear to me. I don't think he gave a very good reason. I think what we are hearing is they don't have the votes to do it. It's a 5-member commission. There are 2 Republicans who appear to be against going forward in any kind of aggressive way. There's a Democrat who is aligning himself with them. You got 2 who apparently want to go forward. But there's no question, whether you have the votes or not, you go forward and you make the case. And you go to the President of the United States and say, Mr. President, I need your help to get the votes here, but we have got to do it, or ask for their resignations. But, I can't go out to any event in the state of Vermont. And I just went to a whole bunch of parades over the Memorial Day weekend where people do not come up to me and they say, do something about the high price of gas and oil. And I expect this is happening in every state of the country. And when you see articles like the Wall Street Journal today that tells us that banks are making huge amounts of money by speculating in oil, that's just unacceptable. That is unacceptable. And it's not just for the individual person who has to pay higher prices at the pump. This is impacting our entire economy. We're trying to struggle out of this terrible recession. We're making a teeny bit of progress, not much. And then high oil prices are going to have a very detrimental impact on this recovery.
So does your bill mandate, I guess, any kind of repercussions if they don't?
Sure. What the bill simply says is we are going to do what they were supposed to do, and say there will not be excessive speculation. This is what it will look like. You cannot do more than this, and that will be it. Of course, there'll be penalties if people break the law.
Have you reached out to the White House in terms of trying to lobby for this
Yes.
in the Senate to try and? So I'm assuming there might be some Democrats who would be on the fence on this issue, as they are on the commission.
Yes, we have talked to the administration.
As you said, reining in excessive speculation of oil is not a new idea. What's new in your bill that will address this?
It's going to be very specific. In other words, we're not asking anybody, we're not requiring. This will be the bill. In other words, if this bill is passed, speculation will end, period. That's it. We will delineate very clearly about the kinds of limits that any company can control. And we will do away with a number of loopholes that now exist. So it will end speculation, period. All right? Anything on the budget?
Anything new on the possibility of what the community block grant system could look like, or cuts that might be coming down through that?
On Medicaid?
Well, not just Medicaid, but also across the board on that would go more toward community actions agencies, sort of, that would sort of do something.
They're in danger, no question. I mean, community services.
Community service block
Yeah.
grant, that's what I meant, yeah.
Look, the Republican budget says that we are going to make huge cuts in Medicaid, which will clearly impact children's health care all over this country. Many people in Vermont, many families, now have their parents in nursing homes paid for by Medicaid. If over a 10-year period you cut $770 billion in Medicaid, which the Republicans want to do, that burden is going to come back onto the kids trying to take care of their parents. It will mean, by the way, that at a time when we have 50 million people uninsured today, no health insurance, and the hope is that in a couple of years the health care reform bill will cover 32 million of them. If the Republicans were to get their way, it would mean that over a 10-year period we'd go from 50 million uninsured to probably 80 or 90 million uninsured. I mean, it is incomprehensible. Among many other programs that the Republicans want to cut are community services. In our states, that's the Community Action Program, which is the infrastructure that helps lower income people with emergency services, whether it is food or keeping their electricity on or whatever it is. But it is not just community services. It is not just education and Pell Grants. It is not just environmental protection. It is virtually every program that you can think of. And then, having made these savage cuts, having ended Medicare as we know it, then what they decide to do is that at a time when the richest people are doing phenomenally well, they say, hey, that's not enough. We're going to give you, over a 10-year period, $1 trillion more in tax breaks by lowering the tax rates for the upper income people from 35 to 25%. At a time when corporate profits are extremely high, they're going to lower corporate tax rates at the highest level from 35 to 25%. $1 trillion over 10 years. It is unimaginable. It is literally incomprehensible. Every poll that I have seen suggests that the American people say, this is, just off the wall. It's not something that we are going to allow to happen. Now, the issue is the Ryan plan, the Republican budget, is not going to pass. I don't want to suggest that it will. The president would veto it tomorrow. The Democrats in the Senate will never accept it. But the interesting question is what will the president do? How strong will he be in saying to the wealthiest people in this country, I'm sorry, you're doing really well, while a lot of people are hurt in this recession. You've got to pay a little bit more in taxes. Say to the large corporations whose profits are very, very high, who enjoy all kinds of loopholes, so that we published a report some of you may have seen last month. 10 major corporations making billions in profits, not paying a nickel in taxes. That's got to end. You don't destroy Medicare, make huge cuts in Medicaid, in education, and then say to the richest people in this country, hey, we're going to give you more tax breaks. So the president has got to be strong. Democrats have got to be strong, and I'll do my best to see that that happens.
Can you talk about the demand on FEMA funds? Are you concerned that
Absolutely.
towns that drive and think about all the natural disasters across the country?
Absolutely.
Here in Vermont, you worried that.
Right. When we talk about, that's an excellent point. And I know the chairperson of that subcommittee, Mary Landrieu of Louisiana, is concerned. So if you're going to cut back on FEMA and Homeland Security in that sense, at a time when we're seeing tornadoes in the Midwest, tornadoes in Springfield, Massachusetts, when you're seeing flooding all over this country, yes, there is a lot of concern that if you make these devastating cuts, communities are not going to have the resources in order to rebuild and not get the help that they have traditionally gotten from the federal government. But that is one area that we are very concerned about. But I got to add to that is Medicaid, Medicare, Pell Grants, environmental protection, the needs of the poorest people in this country. They are all being threatened by this horrendous Republican budget.
Back to speculation, do you have a timeline about when this is going to be moving through?
This will be introduced as within the first week that we're back.
And then, do you have any idea how quickly it will move?
We're going to try to get it onto the floor as soon as we can.
Yeah.
Yeah. This is, and some people say, well, oil prices are going down a little bit. It used to be $4. It's, I think, about $3.82 or something. But this is a problem, and I don't know what oil prices or gas prices are going to be tomorrow. Nobody does. But this is a problem that has to be dealt with, or else we're going to continue to see these huge spikes and people paying far more than they should be paying. So we are going to be aggressive on this issue.
Any updates on the waiver talks with the administration? Between the
Well, the
delegation?
administration is pretty good on this. The administration has indicated their support to allow Vermont to use its federal funds in a single-payer manner, and we support that. The argument that we're going to make to our Republican friends who tell us that they really don't want the federal government involved significantly in health care is, hey, here we are saying is let the states have a lot of flexibility, not just Vermont and single-payer, but other states who may have different approaches. Let them have the flexibility to use that federal money, not one penny more. We're not asking for a nickel more in federal money. Give us the flexibility to do what we want to do, which is to provide health care to all of our people in a cost-effective way, which is what I think a movement toward a Medicare for all single-payer system. It's going to be a tough fight, but we are engaged in that as well.
The House had a vote last week on kind of the future of the war. Is the Senate working on anything similar? I mean, you referred to the budget,
Right.
unfunded wars.
There are many ways, I think, that's a very good question. There are many ways, I believe, that you can move toward significant deficit reduction without making devastating cuts to the needs of working families or the elderly or the sick. And one of the ways is cutting back on excessive and wasteful military spending. We introduced a provision in the last Department of Defense bill, which showed, the study that came out of that provision showed an enormous amount of fraud within the DoD in terms of their relationship to contractors. Hundreds of contractors ripping off the Department of Defense. We are now spending, and that's an issue that obviously has got to be dealt with and could save taxpayers a whole lot of money. Furthermore, we have to remember that defense spending, which is now including the two wars, at about $700 billion a year, it's a lot of money, has tripled since 1997. My own view is that we should accelerate the rate in which we're bringing the troops home from Afghanistan. I think our troops have done, I was there, I was very impressed by the work our troops, not just from Vermont, but all over our country have done in strengthening the Afghan army, in working with the Afghan government. But 10 years is a long, long time, and I think we've got to bring those troops home, and I think among other things, when you do that, you're going to save money on your military budget. Okay, great. Thank you all very much.